All right. Well, good evening to everybody that's joined us here this evening. I know you've had a long day, so I'll try to, honor your time and make good use of it and make sure that the discussion about how you're going to propel your practice forward and make a unique experience for your patients that really drives results. And ultimately, what we're going after there is that case acceptance. So that'll be the discussion tonight. I'm Dr. Grant Olson from Innovative Dental in Springfield, Missouri. So let's go ahead and get started. I'll introduce you a little bit more about myself. So there's my family. There's my crew. I've got my wife there, Lauren, and then Riley's my 4-year-old, almost 5, and I've got Gabby, 11, and Hallie, 9. So that takes probably a good portion of my time outside of dentistry. I know that we all have family that you probably cherish as well. That's why we do what we do, and it's pretty exciting to share life with them that dentistry gets to provide. So pretty cool. I'm also a dentist, right? So that's the second thing on there. I love changing lives with smiles, and tonight we get to talk about a really amazing technology that allows us to do that more effectively. So that'll be a lot of fun. And then, man, I love barbecue. If I wasn't a dentist or transforming lives to smiles, I would definitely be somewhere grilling something and barbecuing something, smoking something. It's what I like to do. Ribs, pulled pork. Don't get me started. This would be a very long webinar. So I hit and hunt. I'm no good at golf, but I like to play it. And I found myself really enjoying marketing. I like the challenges of getting an idea out to people and trying to make it hit and land and see the conversion. Basically, see people be able to accept and do things that maybe they weren't before by effective marketing. So I didn't go into dental school to think marketing would be it, but here's an example of my crazy marketing. So I wanted to show this video. It's a little bit grainy. We tried it earlier and had a little bit of jitteriness, but I actually recorded myself doing Propel, and I did this in a way to obviously poke a little bit of fun at the whole thing by doing it on myself. But believe it or not, it's been incredibly helpful for converting patients to do Invisalign and braces and other aligner therapy in our practice, because they get to laugh and see that there's nothing big about it. They understand that there's something unique we're doing for patient care, because we explained that, but kind of a fun way to set yourself apart. So I don't know, maybe you guys are going, well, that's crazy, but might be a little bit of fun if you need Invisalign or braces. Maybe do a little bit of Propel on yourself and have fun shooting the video. Obviously, it didn't hurt. I was totally numb, but it was a great way to get the ball rolling about talking about this discussion of MOPS. So what you're going to get from sticking around tonight and spending your precious time on this webinar is I'm going to hopefully be able to give you some essentials to how Propel has been successful in our practice and really driven a good experience for our team and our patients. I'm going to go over MOPS and kind of the boring stuff, which is the science, the methods, some ways that you can implement Propel and MOPS. And then I'm going to simplify it and basically use the layman's terms that we like to use. Obviously, that's what we use 95% of the time. The only time I get to nerd out is with you guys on a webinar. So we talk a little bit of stuff that honestly probably would put us all to sleep if we talk too much about it. But it is interesting to know how this technology works, because it really is amazing. And then, none of this really matters if we don't have a great way to implement this. So hopefully you'll get that throughout this webinar. And I'm going to go ahead and give you guys an opportunity at this point, because I'd like to get your thoughts on how many of you have used. Let me see if I can do this correctly. There we go. Got a option for you guys to give me your thoughts on how many of you used Propel or MOPS. Well, so we got about 2/3 of you have voted, and it looks like 50-50. So that's interesting. That's good to know. It gives me some insight here. Make sure I'm back and showing. There we go. Everybody hopefully seeing that there. Well, good. I didn't share the results here. Let me show you that. I'm getting new to this here. All right, there's your poll results. You can see we had 42 to 58. So, a number of you have yet to use a Propel or any MOPS technology. So this should hopefully be a good discussion to get you excited about it. So, all right, so I'm going to take a break from the discussion about getting into MOPS, and I'll kind of set it up a little bit with I feel like what is the most important and kind of the critical component to why in the world would you even, since there's, you know, more than half of you haven't used it yet, why in the world would you even want to implement this into your practice? And so for me, there's always a litmus test, and you guys probably all have a mission statement, but every time you hear about a technology or a procedure or a system, you kind of want to run that through. Does it fit your mission? Is it going to help you achieve it better? You know, this is a really good quote I remember reading from Paul Homily, and it kind of tells you why you'd want to create a mission statement and get your team all behind it, is because really to do dentistry, you can do basic stuff almost by yourself, right? Fillings and basic crowns. You don't need a whole lot of communication and help and assistance and confidence built by your team. You can kind of do those on your own, but it takes a team to provide advanced dental care. So, you know, when you're starting to combine complex treatment, I think there's a huge advantage to your team being all in, understanding the treatment, at least to a level that they can confidently deliver that message to your patient. And so our mission statement is, our passion is to create brighter smiles through innovation. So when we want to implement a technology like Propel, it definitely lines up well with creating a brighter smile with innovation. So also, I wanted to share just kind of how it fits maybe our vision. And our vision, we want to transform the way people view going to the dentist and the way that they see dentistry. And so we kind of try to think outside of the box. There's a visual of our practice currently, and I share this with you just because we're trying to think differently and kind of develop a different idea about how we can help the patient feel like they're not at a dental office. And so this is our all-in approach to that. You can see on the bottom, that's our new facility we're building here in Springfield, Missouri. And you know, it definitely something that sets us apart is offering the accelerated Invisalign and other orthodontic treatments with MOPS. All right, so a few pictures, I'll kind of get through these quickly, but I wanted you to at least feel and see what sets us apart. That's why this would fit into an office, which I'm sure you guys, that's why you're listening. You want to figure out how to maybe set yourself apart and you know, create some differentiation in the marketplace for people to come choose you and then give them an amazing experience. So this is our environment. We try to give them a 5-star experience and deliver coffee, which I absolutely love, and just try to make people smile and not think that they're at a dental practice. There's our golden retriever. He's our pet therapy dog. And then we've got some nice water features that our patients can see outside of our office. You got a projection screen for them to enjoy while we do transformations, and thinking about patient comfort there. So you've got a massage chair. We do CEREC dentistry, so they're able to get a massage while their crown's being mailed and baked. And then we've thought about maybe putting some TVs above the patient there to be able to relax and not just stare at a blank wall above. So this all fits into our, you know, how we want to, you know, deliver clinical excellence. And so this sets them up for an experience that they can see how this technology will fit into that for them. You can see we're using 3D technology with this patient. And then this is Amanda, our Invisalign coordinator. And this, obviously these are staged photos, but that's how she is all the time with our patients. And you can see how excited she is to deliver a smile to our wonderful patients. And that's the key, right? I mean, I think that in order for us to find success here with this technology, and really any technology, you got to get the team on board and have them excited about what it does. So, and then ultimately at the very end of this case, you'll see how we've utilized case acceptance, which obviously if you do all of this and it doesn't turn into case acceptance, it's not going to help you fuel that vision and make a difference in your practice. So here we got some opportunity to show what we've done for people. And I think it's really nice to do great work, but if you don't capture it, and we feel pretty passionately about this, and you'll see some photos I've got. I'll do some case studies for you so you can see some treatment we've done with Propel. I think it'll be helpful. You'll be able to be a little bit more of a believer in what MOPS and can do for really difficult treatment. But you can do all of that, and if you don't really capture the before and after, you know, the quality images to show people, you're gonna lose that ability to have them believe what can be done, and that's really powerful. So we found that utilizing quality photos in our marketing, and then you'll see over here in the lower left, we've even used capturing a video interview for patients and try to, you know, even if you got to do it, you can't do it yourself, pay somebody to put together a quality piece that exemplifies them saying things like, hey, I love the way I was treated here, and can't believe how quick the treatment was done. And that's all going to help you see this technology really work for you, right? All right, let's jump into the science. What makes this work? How does it work? I think everybody, when they first heard about it, is skeptical. Hey, you just drill little holes in the bone and all of a sudden teeth move. And it makes sense. I think the way I was explained to it first was that you have this basically you're causing this injury, this micro injury, this trauma to the bone that is going to necessitate healing. And when healing occurs in bone, obviously cells are going to change over quicker. It's going to allow for the bone to become more pliable. So here you'll see how that kind of works in maybe a little more science terms, but you got the cytokine production, and then you got that rate of bone remodeling is increased, and then you see the bone density decrease. This does a number of things when you're talking about moving teeth. So a little graphic here to help you visualize this. When you are obviously pushing on a tooth, you're causing inflammation, and inflammation then leads to the vascular constriction and elevating those cytokines, basically the basics of tooth movement. You can see a little clearer there how the cells are working on the side where you're putting the force. This is what happens. Obviously, if you put too much force, you can have some undermining resorption. That's not what we want. A little hard to do that really with Invisalign, but really hard to do that with any sort of clear liners and MOPS, because you're going to make the bone that much more pliable. Here's a really detailed example of how that's actually happening at a cell level. You're getting that resorption, and you're getting the reversion and formation, and then finally that mineralization that occurs. And the question I think I get from patients is there any, anything that's damaged afterwards? Am I having any side effects? And the great thing is you can say, and I can tell you after doing 1,200 cases with MOPS, I can tell you with certainty that that's not an issue. So you won't see any side effects done correctly there. So, when explaining it to the patients, you want to be pretty clear about how it's micro-invasive. There's very little to no recovery time needed. As luck would have it, my wife is probably the worst case of recovery, and it was less than 24 hours. So she was sore for about a day, but most people, including myself doing Propel myself, there's next to no discomfort afterwards. Very, very minor, if anything. Tylenol is typically sufficient to cover any of that. So that's an awesome benefit, because I think people are kind of scared of that, especially if they go online and watch a video that shows a bunch of blood. Also, not a whole lot of training needed. You could charge some to the patients, so there could be a cost, or you could just include it. On our practice, we see it as a win-win, so we really don't charge a premium for that. There's multiple device options. We'll get into that when we talk about methods, but there's a single-use reusable handle, and then there's a power driver. All right, let's get into the methods here. So here you'll see there's a reusable handle. This is probably my favorite way of doing Propel, because I can get that tactile feedback. So you'll see that fourth down on the list there, but it really is probably first on the list for me as a clinician, is when you're creating these dimples in the bone, you want to be very careful that you sense if you're in bone or in root. And obviously looking at a 3D x-ray helps you know where those roots are at. Obviously looking at the angulation of the tooth will help all of that, but you're going to appreciate having that tactile feedback, I think, for using it. That might be the biggest advantage of using this reusable handle. It's time efficient. I mean, I can probably propel an entire arch actually both arches in a matter of 4 or 5 minutes or less, because it's just such a quick in and out with that device. It's obviously cost efficient, and you're going to find that the tip is pretty easy to engage in the bone, and obviously you're going to reduce some waste there with that. So pretty nice. There's the power driver handle. I think there definitely is some use for this. I think that we put in there the posterior application, because it is hard to access if you're needing some pretty crazy arch expansion on a very narrow arch. And I'm excited to show you this case coming up here in a bit, but it's where we actually, in an adult, got arch expansion. If you're trying to get that, it is hard to reach with a reusable driver like I just showed you there, but this powered one gives you an ability to get there a little easier, but it is kind of awkward to go in and out with that. It's definitely slower and might be good for those who don't have, maybe don't place implants or don't do much surgery. I would say probably most orthodontists might like this because they're not doing a bunch of invasive stuff. So this would feel pretty non-invasive when you use this drill. It doesn't, obviously if you're using a hand and driving it in with your hand, it just feels maybe a little more invasive. So I think there's some benefits to that. It obviously helps you prevent some fatigue. You will have to put quite a bit of pressure still, but it'll definitely keep you from having to get that wrist from rotating quite a bit. And then you're going to enjoy the fact that it's got all the benefits of small waist and proprietary tip there to help out with that expansion. So vPro 5 is an amazing technology that, man, it helps seat trays and it helps us. We use it a ton for minor relapse in our office because we're able to use a device that's easy for compliance at that point because the patient's trying to save themselves from going back into paying for Invisalign or paying for new retainers. So they're pretty motivated when they've already shelled out the money for aligning their teeth, and then they're faced with the reality that, hey, you didn't wear these well, and so you've got some movement. This will really help, and a lot of times we can correct that pretty quickly. So here's a great example of what those would look like when you start, and then kind of what you're able to do with that vPro 5 and get that amazing result there at the end. So kind of nice to avoid those Viveras. I don't know if you guys have bought another round of those, but they can start to really add up. So, all right, I thought this might be a good time to throw this question in. It is, do you find explaining, for those that, I know there's only about half of you that have used it, but I think that this might be a hurdle. I kind of wanted to get your thoughts on it. Do you find it difficult explaining MOPS to patients? Is there a challenge to that, or you guys find it easy, or do you rarely have trouble with it? So maybe that'll give me some insight on how much time I spend talking about how to help with that patient communication. Looks like, mostly it's in that sometimes range here. I'll go ahead and close the poll. Thanks for participating there. About half of you shared your feelings on that. It was about 16% often, 20%, so 63% on sometimes. So, all right, and then the simplified. I think these are the three things that I feel like you really want to nail with your team. They need to all get this. They need to have this really right off their tongue when they're explaining it to patients, keeping in mind that your patients are not going to just hear it from you. They're going to hear it from your front desk, maybe even your scheduling coordinator, your treatment coordinator, your assistants. So they're all going to hear, why would you do MOPS and why would you do Propel? So this will help you nail that. So you want to be able to go, hey, it improves the speed of treatment. So you're going to see adults find that, and kids, young. I don't do a ton of young kids, but I would say 15, 16 above, we start using some Propel, especially in some difficult movements. With reduced treatment times, you're going to get there with that treatment. Quality, you're going to get a nicer result. I mean, teeth are just going to move more predictably. That 5-10 degrees of root torque you're trying to get, that just trying to screech that out, you're going to get that more likely when you use MOPS. And then comfort. If you're reducing the density of the bone, you're reducing the force necessary to move those teeth and those roots. So that's where you're going to take down that pressure and thus give the patient a much more comfortable experience. I can attest to this. I've done Invisalign twice. Because if you're like me, you're probably a terrible patient and you didn't wear a retainer. And so I got to do Invisalign twice. Does anybody have an Invisalign rep? I know you can't answer me, but Invisalign rep that's permanently in Invisalign? I do. I have one, but he's probably in his 5th, 6th set of Invisalign. So it tells you that if you get this stuff for free, that you just are next to no cost. He gets it for free. Obviously, we pay less, but or refinements, you can just not wear retainers. But I'm pretty good about it now. I didn't want to do it again. But the point is, I did this twice. The second time around, I did Propel, and it was drastically different as far as my comfort. So I can attest to it. All right, let's get to some, I think this is really where the proof is, right? It's in these photos and ability to show that this is stuff that I think most people would go, I didn't even think this could be treated with clear aligners. And I believe, I can't see my notes right now, but I believe this was 9 months. So I'm trying to be pretty clear on that. But 8 to 9 months, something like that. But this guy, you can't even see it. He's got ginormous, if that's a word, tori. And you can definitely appreciate the exostosis he's got there on the exterior, on the lower jaw. And look at the alignment we were able to achieve with this smile. I mean, pretty crazy. You're able to totally get that deep bite, which is what, 90%. We got that open, the nice, 2 millimeter overbite, and all of that crowding that arch form. That's something that's, I think, interesting, right? Is be able to change arch form, which is something I think most, at least in our area, maybe it's different in yours, but a lot of dentist orthodontists will say Invisalign doesn't work or clear aligners therapy won't work because you can't, change the arch or correct deep bites, and these type of treatments that really actually can. And I'm sure you could do it without, a MOPS, but man, it might take you 5 years or something. But with MOPS, look at this. I mean, nine months. So there's a lot of, and what we did here, for those who are wondering where we might have done the Propel treatment, is you can tell those premolars are tipped in quite significantly on the upper arch there, really in the lower arch as well. So we definitely targeted those areas when we did Propel. And for this patient, I actually double dimpled, and that just, I just did a couple penetrations in between the roots of those premolars on top and bottom. And so that way we got a more active response from that bone, and definitely got a good result there for him. This is another one that there's certain cases that you're kind of proud of. I'm sure that everybody has those in their portfolio of treatment or in their mind where they've done something and whether it was a veneer or cosmetic case or something, you're just kind of like, that was really, I feel good about that. And maybe with some challenges you faced, obviously this patient's just the bite and everything's a challenge. But sometimes, I don't know if you're like me, I'm super competitive. So this was one where I actually had an Invisalign rep that was not, he's not in our office anymore, but he told me that there's no way he is an Invisalign rep. He told us we couldn't do this, we need to send it to an orthodontist. And this patient loved us, trusted us, and really, she's the one who kind of pushed and said, no, I want you guys to do this. And I said, man, this is a tough case. I don't know how the results we might get for you, but we really put our effort into it, and she did a great job. Wore those trays, and look at that lower arch. Still, I just scratched my head how that lower bone just remodeled and shaped totally different than what she had there before. And then the arch form, the way that we got that expansion, we didn't just tip teeth there. We got a full, 3-4 millimeters of arch expansion. So pretty exciting results when you're talking about this technology. This is another great one where you've got all those crossbite. You can see the damage it's doing to her teeth. This is where some good discussion about problems and consequences and solutions. And then maybe you guys are familiar with PCS, but letting the patient know that you couldn't help but notice that you're damaging your teeth. Consequences are, if you leave it like this, it's going to continue to cause damage, wear, and chipping. But hey, great news, I've got a solution for you. It can align your teeth and avoid all those challenges. So that's just a brief run through of PCS, but that's what we use to help people that have a problem like this, because I don't even think she came in wanting alignment. I think she just wanted to keep her teeth. And so this is a discussion that we had is, hey, how can we align teeth, and how does that make sense to keeping your teeth? And you can see the damage she was having. So made a big difference for her. I want to say 8 months here. So in our question and answer session, I'll try to be able to pull those notes up to give you answer those if you do have questions on specific times. But none of these treatments, I know none of them were longer than a year. So here's another great one. Pretty much more bread and butter as far as alignment, moving teeth there. But we've got some nice results. This was 3 months, and so you got a patient that you tell them, hey, it might take 5-6 months and you're done in 3. How excited are they? And they're leaving great reviews on all your social media and really help you get the word out for what you do. One key here that is important to kind of highlight is that we use in our practice, the Propel treatment with whether we're using braces or Invisalign, we use it to accelerate the result the patient wants from something else a lot of times. So that might be an implant, or it might be, they've got a lateral that just they don't like the way it looks, but it's crowded out. Maybe it's a peg lateral, like you saw in that last one. Or you've got a cosmetic treatment that you just can't do because the teeth are all, hitting each other, like a few I just showed you ago. So that's where I think it helps us. I know it helps us convert those treatments because we're able to give them a reasonable time frame that adults kind of can commit to. It's funny how impatient we get with the technologies in our life that we just don't want to wait for anything. And I don't know if you guys are like me, but I'm just gonna get a soapbox for just a second. But I look online and I see, and I follow a lot of people's dentistry. But one of the things that drives me crazy is when I see dentists that have done these crowns and veneers on crooked teeth, and they just prep the teeth down to nothing and restore them. And I'm going, man, why wouldn't you encourage the patient to save their tooth structure, align their teeth, spend 5 months, even if you don't get it perfect with alignment, now you've helped the patient keep their tooth structure, and you can give them a much healthier long-term result. And so I love the fact that I don't have to sacrifice the quality of care to give the patient really what they want and what I want. And that's a, Propel MOPS is a huge component to that because we're able to do these things so quickly. So we are able to get more acceptance, and we obviously are able to do more complex treatment. Let's get into our practical implementation here. So I think if for those who haven't, this might be geared for those who haven't. So if you have already implemented this, maybe you can take this advice. It's something that's worked for us when it comes to any technology or any changes to our team. I know if you're like me, we all struggle with change, but when we struggle, our teams probably struggle twice as much with change. And so this will maybe give you some advice that I think's worked here for us. So how do we overcome that? You have the hesitations from cost. I think from us, we're going, what's our return on investment? What's the cost of not doing this? How much is it going to cost for training? I mean, are you going to train somebody and they're going to leave? Are you going to spend so much money going to courses, in different parts of the country? How are we going to communicate the benefits to our patients to where they understand it and we're able to help them with this? So current success, why change? You're doing well right now. What's the reason? Why would we go to all this effort? And these are a couple companies that I threw up here. You have BlackBerry, you have Yahoo, and you probably remember when they were awesome, right? Blockbuster's another good one. We all remember when they were super successful. They kind of stopped investing in themselves, right? And stopped changing with the times and keeping up. And the current success they had was the greatest enemy to future success. So they weren't able to keep up while other companies and other businesses came around in their space and quickly and totally wiped them out. So the brand is irreparably harmed at best if you don't keep up, or at worst, you're out of business. And I think that this is the consequence of a moving market like we have, where social media, the word gets out, right? I mean, I know that there's only a few orthodontists here in town that even started providing Invisalign only because we were having so much success with it. And that tells me that, they're going, man, this is finally impacting our business, and they're way behind the game on this. So it'd be nice for, I think, everybody on this webinar who hasn't jumped in and tried out the benefits and seen what Propel can do for your practice to be on the leading edge of this, not find yourself behind and trying to make up while the rest of the people providing it are having recognition for that and gaining a reputation for their speed and excellence for patient care. The solution, so we have this as one of our core values. We call it relentlessly innovating. So it means you just got to constantly be reinventing yourself. And so, giving your team the authority to do that and the excitement to do that. Here's a few companies that are about relentlessly innovating, right? I mean, Google, Apple, Netflix. Gosh, they're different every year almost. And then I think Propel needs to be thrown in there. They're a company that saw a problem, and that's time and discomfort and the whole moving teeth issue as an adult when your bone's more rigid, and coming in and saying, hey, wait a second. And I think they'd have to correct me if I'm wrong, but I was told this. So I'm gonna give a quick story. There was I think the reason why Propel even was one of those technologies that was found out is that they were realizing that in orthopedic, so sports medicine, when an injury would happen, they would go around and dimple around the fracture site on like a bone on an athlete to try to help increase blood flow and do basically what Propel does for moving teeth. And they would find that these athletes would get back into the game in like half the time. And this is something they've been doing for decades in sports medicine. And so Propel, I don't know the whole story behind it, but they saw that this was maybe an opportunity and started researching this for orthodontic movement. And they're geniuses because they found out that it actually is incredibly impactful. And so I can attest to that. They were onto something. So this is obviously, that's our logo. We want to be known for relentlessly innovating. So let's get into some practical steps to integration and implementation of any technology, but specifically, how do we get this going with your MOPS and Propel? So first and foremost, you'll notice you have to motivate and train your team. And I know that we didn't go to dental school to motivate and train our team, but I'll tell you, you'll struggle as a dentist. You'll struggle to see the life that you want to have, the vision that you have for your practice. You just can't do it without a team that's, you're training actively, or you're at least maybe purchasing some training for them. And then you got to find ways to motivate them. And that's not just with really, it's honestly not with money. I think most people think I just pay them more or motivate them with some bonuses. I think it's much more complex than that. So it starts with them. And then you got to make it the standard of care. I find that some practices that dilly or dab, you know who you are. If you're out there, you're like, I've tried this. I wouldn't really go all in. Maybe it was with CEREC, maybe it was with an implant technology. I don't know what it might be, but maybe there's something that you're still kind of going, I wonder if I just went all in with it, what it might do for my practice. This is kind of where I say make MOPS the standard of care. So in our practice, it is standard. It's not like, hey, are we going to be doing Propel on this patient? Are we doing a MOPS? Or what do you think, doc? Is it necessary here? And for us, it is 100% standard. It's the best care we can provide our patients. It's not even an option for treatment. And that's our philosophy. You don't have to necessarily do that. You could have it where the patient, has the option to do it or not. I think that you're going to find more success. We have with just saying, hey, we want to be known for excellence and all that we do. So we're not going to shortcut treatment just because maybe the patient doesn't necessarily want to pay the $100, $200, $300 more you want to charge for it. We're going to include it in our base fee. It's going to be included in our treatment. That way we get the best of the treatment for our patients. And so I think standard of care is important. You got to map out that pricing structure, and I'll give you some details to that. We just boost the overall fee, and it's built into that. We don't even have to be hardly anything more than our neighbors. Plus, think about this, you're saving time on treatment. So you're going to more than make up the cost of the Propel tips and the treatment, the chair time by just providing a patient a better, quicker result. And then you want to, none of this really matters if you can't convert it into, that maximizing that case acceptance. So it's if you haven't done these things, and I think you're like, okay, why is this guy getting into practice management? And talking a lot about that when we're talking about MOPS, but honestly, MOPS is not something I could talk about for a full hour and just in detail and without driving you probably nuts and just repeating myself. And I'm sure I've already done that, but now I want to get into the practicality of how to make this work in your guys' practice. And so when I put this slide together and it says, hey, mission, vision, core values, I know that if you're like me, it was like 3 years into my practice, owning my practice, I hadn't even developed this. I heard about it. I'm like, okay, that seems abstract to me. I don't know why I would, and then it finally dawned on me that, well, what am I going to work for and why am I there? That mission statement is so important, because if I can't answer that clearly, the team can't, and it has to be the framework for which you implement things like this MOPS procedure. So you really got to be declaring daily what is your organization's purpose and their focus. Vision, that's that photo of the future we're trying to create there, right? A new office, the vision of what we want to do at that office for our patients, and how do we want to impact dentistry as a whole. So that's kind of your more lofty, almost unattainable goal. Like, I want to transform dentistry. I understand I'm just one dentist. That's not likely to ever happen, but it's a lofty goal. So that's the vision, right? We want to transform the way people do dentistry. And then core values, those are some of the few I mentioned earlier, but one of those being that relentlessly innovate. The reason that's in there is our core value is that people will innovate and find success, but then they kind of go, once again, you kind of fall asleep into that success and you don't do it again. And so you want to continually or relentlessly innovate. This is a personal experience I wanted to share there. You can see the testimony from this. It builds trust, confidence, and clarifies expectations, eases nerves, also tells your patients that you are you're really lined up with giving them what you've already told them is important for their oral health and aligning their teeth and giving them the best. And so it really kind of ties those things together and tells your patient you're not a phony. I've had people come in and say, you know, I did Invisalign with you because I've watched your videos of how you've done Invisalign on yourself, and I figured, hey, if you're doing it to yourself, you're not making it up. And so I think there's a value to that. So I'd encourage you to get your team involved and help you know, use that one of them to showcase your treatment and your Propel treatment. So that'd be helpful. So you want to make MOPS the standard of care. I kind of hit over that pretty well. So every patient, no exceptions for us. By the way, these are all pictures of our team. So you can kind of see there's one of our hygienists there, Jackie. All right, so the benefits of kind of performing the treatment this way is you're going to get consistent communication. You know, you want to be using that in your morning huddles with your team. You want to be using it chair side with your team. You want to make sure that in the morning huddles you have, I think a lot of people miss the opportunity by maybe only having your clinical morning huddles. I'd encourage everybody to make sure your front office, your back office, people are on the phones, are in your huddles, because they're the ones that are talking to the patient first. And so they might not communicate the way you do, and that's a disconnect, right? We want to have them saying the same things that we're saying in the treatment room. Uniform clinical execution. So we're going to do this the same way every time. We don't deviate from the protocol. There's some minor deviations that we use for, like I mentioned earlier about that arch expansion, we might double dimple, but for the most part, we kind of try to keep things simple here. With our treatment coordinators, we don't make it too complicated on them to put in the proper ADA codes, how it's billed, and then obviously simplifying the scheduling. So how much time do we give for the additional time to do Propel, which is pretty minimal. Here's how we've mapped out our pricing structure. You guys might have these options in your software, but you have an exploding code for orthodontic treatments. And so we kind of have that where you can enter in certain orthodontic treatments and boom, all of the codes come in. The macro itemizes the treatment for insurance purposes, but is presented to the patient as a one blanket fee. So I think that's a huge advantage to not drowning patients in itemized lists, but they want to know what it's going to cost them total. And so we kind of give them that broken out fee, or the total fee, sorry. The MOPS procedure is billed as the corticotomy. So if you can see that there, you have the D7296 or the D7297. So you're able to use that as you know, corticotomy treatment. And then we use a accelerated dummy code basically for putting in additional fees for if it's a super challenging case. All right, so kind of one more slide I think that'll help with that case acceptance aspect, and this is where the patient communication really becomes key. And something that I'll just kind of share with you, a little secret sauce that's worked really well for us. So you're welcome to take it and hopefully it would work for you as well. But we keep the treatment coordinator is the new patient assistant. So the same person that would be presenting the treatment and the finances is the very same person that does the exam, x-rays, scans for the iTero scan, so we can, you know, show them the before and after, has the discussion about Propel and MOPS. And that way you just don't have this handoff discussion. And what you're doing too is you're obviously gathering this very important key is that where's the patient coming at? How are they coming at this treatment? What's their motivation basically? So patients are all obviously motivated by a lot of different factors. And if their biggest concern is comfort, then Propel. If their biggest concern is speed, then Propel. So if their biggest concern is an excellent result, then Propel. But we want to talk about MOPS and Propel from that standpoint, right? So we want to phrase things in a way that really hits home with them. Then obviously I think it's good to illuminate some things that they're not aware of. So that's where the health facts come in. So we talk about oral health, talk about long-term longevity, basically that consequences aspect of the problem's consequences solution. So what happens if they don't do the treatment? Where are they going to be left? We use lots of visuals. I think this is key. I think it's a real pain, if I'm being honest. Taking quality photos is tough. If you look around, there's a lot of poor quality photos. Ours, I mean, every once in a while I still scratch my head when we miss an opportunity to capture a good photo. We may took one, but it's not good enough to use. I think I don't have a poll for that, but I bet if I polled most of us here, we would say, yeah, man, I give that camera to one of the assistants and they just don't maybe see what I'm trying to get. And so helping with that, taking a photography course, you're welcome to ask some questions of me here at the end. I'll share what we've done, but those are really important. And scanning the patient every time, that's, if you're going to be talking about aligning their teeth and that scan, that helps them really see what they don't see. Patients have no clue how crooked their teeth are until they see that 3D scan. And then you're able to reinforce that treatment with them. So the coordinator doesn't have to wonder what was said in the room because she was in the room. So that's a huge advantage. And then they do the financing discussion right then and there. So, and then we have obviously some options to help make treatment attainable. Talk about the budget. Talk about how we can be more flexible with their schedule. I think that's another key, that it's not maybe as primary as the speed, the quality, and the comfort, but you're going to be finding that this MOPS allows you to be more flexible because you don't have to have nearly as many visits. So you can master movement, less appointments. All right, so you're going to be shortening that treatment time, decreasing comfort, and you're going to give that positive patient experience. So wow, you're going to get a lot of people bragging about you, and you're going to get to do a lot more alignment. So pretty cool. I have a couple narratives here that I think is maybe helpful for you to see. This is common in our practice, but you'll get our office utilizes the latest technology to make moving teeth a more satisfying experience. This technology reduces discomfort, accelerates treatment by allowing your bone to be more pliable during treatment. Pretty cool, right? And then you'll get half the people that say that's great, half of them, or a fourth of them will say, what is it? And then you'll get another fourth that say, does it hurt? So then you're able to give them kind of the breakout of our team is very experienced in providing this amazing treatment with minimal to no discomfort. We make sure that you will be comfortable. It's a great way to just, you don't need to, I'd encourage teams, those who are saying that you might have sometimes you have issues explaining treatment. I think where people get themselves in trouble is if they start using words that really distract the patient, like if you use the term stab or basically penetrate is not a good word on the gums. I think you got to dimpling is a really good one. So we say dimple the gums all the time. It seems to be one that patients don't get that large eyes about. I would make sure your team doesn't get into detail about getting shots, those words there. You want to say, we make sure you're comfortable. Yes, we do make sure you're numb, but it's only one time and there's a lot of benefit to your treatment. And then really just kind of constantly keeping the focus of the discussion on the benefits. That way your patient doesn't wig themselves out, get all worried, and then find themselves not having a whole lot of excitement. We find that when we keep the focus on the positive nature of MOPS, our patients stay positive throughout the whole thing. The patient shift. So this is something that I think I wrote up just to kind of give a direction for what I think dentistry is, what's happening in dentistry, and I think how MOPS and Propel really fits into that. But the demand for services not covered by insurance benefits such as cosmetic treatments, implants, it's growing. I think there's more and more people that find value in dentistry, and my hope is that trend continues. But patients are more aware of their options. They're much more selective when paying for procedures out of pocket. and consequently they do their research online, right? I mean, how many people here find their patients find them online and they decide which dental office to visit based off of these. They read numerous reviews after that decision. So the public is also generally aware that the malocclusion is a disease that will cost them more to ignore than to treat, and they view their time as too valuable to spend. So I think that that's happening. I think it's good. I think the industry shift is, in turn, dental offices will need to be more to do more to distinguish themselves. So they need to find ways to. I mean, probably most of us on this call, and I'm not going to bash any area of dentistry, but I would say that most of us on this call are probably single practitioners or solo practitioners. Maybe there's some I maybe could have asked, but I think if you are a solo practitioner, one huge disadvantage we have is we don't have a marketing team. We got to be our own. We got to get the word out for why this is differentiating us from the other offices that maybe offer Invisalign or any of the other clear aligner options. So, this is important. We want to set that apart, and the office that uses this technology offers more advanced, treatment, and they can make dental care more convenient and efficient. So we want to educate the public as a priority. I think that's one area where don't count on other companies to do that for us. I think I've been let down by Invisalign for not educating the public on what makes them totally drastically different than Smile Direct Club, for example. And we've got to be the ones that do it. I sat with the CEO of Invisalign about 3 months ago and had a discussion with him. Spoke candidly about the differences between his Invisalign and Smile Direct Club, and I can just tell you that they're missing it. They didn't realize that they should be educating the public and getting the word out. And it made me scratch my head and go, we've got to be the ones that do it. And if we don't, we're going to see these big corporations direct the way patients view dentistry. So where does MOPS fit in? In turn, dental offices will need to do more to distinguish themselves. MOPS is one of those distinctions. The office that uses it, they're going to be the ones that are going to kill it. So I think you guys are already one step ahead. You got this understanding of how this can be beneficial, and I hope to see that you guys run with it. And I'm definitely excited to answer any of your questions about how it might fit into differentiating your experience in your practice. And then I think there's two choices you have here. That's why this page is here. Hopefully this is where you guys are at and thinking. I think it'll make a big difference for you. But right now there's this big push for being cheap or lowering your fees or taking benefits, more along the lines of how do we reduce our price. And I think that's where the team, the doctor, the patient really ultimately get cheated. That there's no way you can give patients the best and be the cheapest. It just doesn't work. So I want to differentiate the experience for our patients, give them the best, give them more than what they were expecting. Don't even have to charge them more than what they were expecting necessarily, but charge a fair fee and then let them be super excited that you gave them an amazing experience. So that's why I put the long run patient experience is king. Gave a few additional cases here just to kind of run through, but you can kind of see these here. I'll just kind of click through them. This is all under 3-4 months of treatment. That's why we put these here at the end. These are super fast treatments. I think that one there actually was 6 months. Awesome. So you can see total crossbite there on this one. This is stuff that I get routinely told that you can't do that with clear aligners. And look at what we can do there, right? With Propel, pretty fascinating. Totally changing the bone, the ridge, and correcting that in such a short time. All right, so now that I've droned on for 50 minutes of your time, thanks so much for your time. I definitely want to make sure I give some time to give you some questions and answer those. So I think I'm going to pop this out here. So if you guys want to type up any questions, I'll be happy to answer what you got there. Look, can you please explain the consent for this procedure? That's a good question. I see that from Archana Wakode. Our office, I mean, I'll be honest with you. We're probably, you guys are probably going to shake your head, but we do thousands of we've probably done 1,500 Invisalign treatments, and our consent is pretty minimal. We do have them signed on a tablet, and it does explain a few that they might have some bleeding, and it might last for a little bit of time, and 24 hours of maybe discomfort. But we don't have a ton that goes into that because the risks are so minimal. So I hope that helps answer your question there. But I kind of have a philosophy about consents. They don't get you out of trouble anyways. So the best point is to always obviously tell the patient what the possible risks are if they're likely, but just do good dentistry, show that you care for the patient. That's what's going to keep you out of trouble. So yeah, and maybe that wasn't where you're going with that anyways, but I just think that's a good philosophy. We don't really have our patients sign a ton of things, yet we do have a retainer consent form and things like that. So they're aware that, hey, if you lose your retainers, you're gonna have to buy more retainers. But for the most part, not too many of that. Okay, how many times during Invisalign treatment do you perform MOPS? So that's a great question. We shoot for one time if it's gonna be under 6 months. Reason being is that typically 6 months of treatment is not going to surpass the efficacy of the trauma, the micro trauma that the MOPS is doing there. So you should get a really nice result with aligning those teeth without having to do it again. Plus, you got to think about this: your major movements are done in those usually the first 3 months, and so you're kind of heavy loading that front end movement, especially those arch expansions and things like that. You're going to be fine tuning things which just don't need as much help from Propel. By all means, though, if you've got a crazy difficult case, and I can't remember that, I think that treatment that I showed you, that it was maybe the second case that was a really narrow bite, super deep, very narrow. I think we did Propel again midway. So good question. When do you use, how do you incorporate with, okay, when do I use vPro 5? I think is what they're asking there. And how do you incorporate with MOPS? So vPro 5, I mean, you have options there, right? You can use it. Now, I will tell you a disadvantage of using vPro 5 during treatment is going to be compliance. I think people will struggle with using it as often as you'd like. I think it does help. So there's nothing wrong with using it. I think you're just going to have to be selective with making sure that your patients will use it. And then I really feel like it's amazing for helping with that relapse. And you do enough Invisalign, you're going to definitely run into some issues with relapse. And so that's where it comes in to be really helpful for us. Yeah, this person asks, to be clear, you're utilizing both MOPS and vPro 5 or just MOPS? And I would say, we're selective with the vPro 5, once again, because of compliance. But it is a highly effective tool to seat the trays. Definitely will help you a ton with the relapse issues. In cases with exostosis, do you notice a prolonged treatment time? That's funny, that case I showed you with that, and I wish I should have taken a full arch where you could see all the mandibular tori, but that gentleman had just a crazy amount of almost kissing tori. So you probably wouldn't have thought that there would have been, I mean, honestly, when we started, I told the guy, I'm hoping this works, but he's like, I'm not doing braces. I trust you. Just do your best. I said, well, this should be really neat to see what Propel can do. And I don't know if you guys have those cases come along. They're like the most fun because the pressure's off. You've got a really nice patient. They're not going to, be upset if the result's not ideal. That was this guy, and it was really showed me and helped me realize what and how amazing Propel is, because I did not see the arch changing like that. I was hopeful, but yeah, I think that you're going to be able to see some really nice results with that type of bone. And really, it was hard to propel it, I'll tell you that. It was hard to get the dimple. So how fast are you switching trays? A great question. So we shoot for 5 to 7 days. You can go as fast as 3. I'll tell you this, if people aren't hitting 22 hours a day wearing trays, which if you haven't done Invisalign yourself or worn clear trays yourself, I'll tell you that that's a lot harder than you think. And so if you're not hitting 22 hours, and I've done it myself, so I've worn trays, so I can tell you that was hard for me to do. You're going to lose tracking too often. So that's why in our philosophy, gosh, we kind of shoot that 5 days. We don't want to have to do so many refinements because people are thinking they're wearing the trays 22 hours, but they're getting 17 hours of wear. And so that's critical for us. I think you're welcome to do 3 days, but you better be selective and make sure that patient understands. They better leave that in, take it out for 20 minutes when they eat, put it right back in. So pretty important. All right, we have, do you complete MOPS prior to first aligners delivery? And yes, we do. So we do it at the very beginning. We do it before or actually we do it after we've done all the attachments, so that way we don't have to worry about hemorrhage. We also do that along with our first stage IPR. How do we handle objections to MOPS? I think that's critical. Some of the things I mentioned earlier, but it's really having your whole team excited about what it can do. It's focusing on the speed of treatment, the comfort during treatment. Because I think a lot of people that are their biggest objection is that it's going to hurt, right? I mean, let's be honest. So you tell them with all honesty that the discomfort is minimal, because it's true. You make sure that when you do the procedure that they're numb, so they don't feel it at all. And I would recommend, for us, we use infraorbitals, carbocaine. I infiltrate with articaine a little bit around the 8 and 9 areas. And then on the lower arch, I use 1 carb of carbocaine split between the mentals, and then 1 carb of articaine split between the mentals. So half and half on both of those sides. That's sufficient as long as I'm not dilly-dallying and I'm in the room within 20 minutes of doing that. So makes them totally comfortable. All they might feel is, honestly, the only area that you got to be a little concerned with pressure is going to be right there between 24 and 25. So, and I think that's because they got the nerve from the genioglossus or whatever that darn thing is. Somebody that knows their anatomy really well can probably explain that to me, but that can be a little bit of a tricky one there, right in between 24 and 25. All right, so if you are using the ViewPro 5, okay, are you always building MOPS fee into your total Invisalign fee? We are, and that goes back to that discussion I had earlier about trying to give our patients a consistent and amazing result, and that being the priority. We don't want to, we want everybody that leaves our office to go, that was the best treatment. Not, I didn't know what the best treatment was because I didn't pay the additional $200, all right, or whatever that might be, whatever your fee might be for adding it. So I know, for example, we build in, we do whitening within our Invisalign treatment. We include the retainers. So yeah, our total fee is probably a little bit more than the rest of the community, but we found that being the value, being the quality leader, man, you get people that really appreciate it, which obviously, who doesn't love to have patients that appreciate quality, right? When they come in and they're like, I just want the best, that's why I chose you. That's a lot easier than the patient that came in and I want the cheapest, that's why I chose you. So I think that's part of that philosophy of why we include it. I'm sure there's probably a number of different ways to skin that cat, but that's my thoughts. Okay, if you aren't using the ViewPro 5, are you using Chewies? We do use Chewies. I will tell you that the ViewPro 5 is probably more effective at seating trays. The Chewies, you got to be careful about the angulation that people chew on it. Sometimes they're sitting there at night chewing on a lateral and actually intruding the lateral, even though they're thinking they're seating their tray. The force of that Chewy, especially if it's going the long ways across the teeth, is doing the opposite for your patient. So do you try to avoid moving molars? No, I mean, I think we move molars and upright molars where we can. I would tell you that I don't propel a ton around molars because it's usually not super necessary. But if we do have like the missing, I think this last case that I've got the screen on here is a good example of that. You can definitely upright some molars. I don't know if we got much uprighting on that lower right, but lower left there, you can see we uprighted quite a bit. So prior to implants, it's helpful. Do you begin all cases with MOPS right at the insertion? Yes, we do. Yep. Yeah, cost of the reusable head. Well, they've got some options for you. So I think they're in the, I don't want to speak for them all, but I mean, they're in the 100 to 200 range, depending on how many you buy. I think that's at least going to give you some ideas of cost. I think you can get it closer to that 100 depending if you buy a lot, right? So we do a lot of Invisalign, so we just buy in bulk and we save some money. But I think it's very well worth it. I don't think that they overprice it by any means. I think it's a fair price for what you're getting for your patient. And then obviously, I didn't say this enough, but we talked about the ViewPro 5 with Propel and MOPS here. You don't have to worry about patient compliance, and you're already asking them to be compliant and wearing their trays. And with the Propel, you can just know that when you did it, you're the one that made the work there. So you don't have to worry about the compliancy of them. So. Ever any issues with mobility following MOPS? Great point. And that's no, we don't. So I don't think that you would have any extra issues. I'm not seeing any extra issues with mobility after utilizing the MOPS process. So that's pretty awesome, right? The bone, you know, if you kind of think about it this way, you break a bone, you get it healed back, and it usually heals back with a little bit more density around that site. And I guess in theory, we can assume that that's happening around these propel sites, but you definitely don't get less bone formation. Just like any treatment at the end, you're going to have a little bit more mobility just because you move teeth, but not really related to the use of propel. Do you utilize MOPS between all crowded teeth or just difficult movements with blue or black dots on the ClinCheck? I use blue and black dots to help signify some areas where I might double dimple or think about. Let me give you an example, right? So if you need to just intrude the lower anteriors, which obviously the bone is just more dense down there, then you might selectively just dimple or double dimple that lower anterior and avoid using propel on the upper interior. So that way, when you put those deep bite ramps, the bite ramps for the deep bite protocol in your Invisalign ClinCheck, you're going to selectively intrude the lower incisors. So that that can be a way that you can kind of trigger the right response biologically from your ClinCheck by propelling the correct arch. So, well, I hope that was good. Has anybody had any other questions? I think those were great questions. Thanks for throwing those out there. And I can give a shout out to my buddy from school there, Matt. So how you doing, man? Good to see you on this webinar. So, but I appreciate everybody for staying tuned, and I hope you enjoyed it. And I wish you all the best in your endeavors with propel and MOPS, and that you just see your practice soar and find a propel, propel your practice forward. So thanks so much. Have a good evening. Bye.